Hey, I'm Dr. Paul, and today I'm going to explain to you what anti-wrinkle injections are. You probably know them as Botox, botulinum toxin. Sometimes people use Dysport or other medications. They're prescription medications that have to be prescribed and injected by a doctor. In Ireland and the UK, it has to be done by a doctor, and most of the world actually. In the States, it's different, but let's not go there. So there are a bunch of different areas you can use botulinum toxin injections, anti-wrinkle injections, but the main thing that they do is they weaken muscles. So if you have muscles that are too strong on your face, if you frown a lot, and then when you stop frowning, there's a line remaining, that is something that can be treated usually with anti-wrinkle injections. So injecting in between the eyebrows in 5 points means you're not able to frown as much, and then easy peasy, you don't have a wrinkle. Except it's not quite as easy as that. We've seen people who have had their Botox overdone. It looks unnatural. It's a little bit frozen. So the best way to do the treatment is to, like any medication, figure out what the best dose is for you. So that's the bit that's a little bit tricky and requires someone to take a bit of time, to take photos, and with a bit of an eye for how to do it. So the muscles on our face are kind of the same on everyone's face with slight variation, slightly different millimeters apart from each other in different people's faces. How do I say this? Different people's faces have different configurations of their muscles. So some people's frown line can be wider than other people's. Some people's, just like some people have a bigger fourth finger, a bigger third finger. Fingers can be different. Muscles on the faces can be different. So when someone's doing a treatment, you need to take a photo, do the treatment that suits your muscles. And then after that's done, you need to adjust 2 weeks later when it's fully kicked in and make sure that you got the right dose and that it looks right. The right dose is the dose that means that when you are not using your face, you don't have wrinkles. The right dose is not the dose that makes it last the longest possible. It's very easy to put in a mega dose, and Botox is not really that expensive. So a mega dose is easy. You can just whack in a ginormous dose. But the problem is maybe not in the first treatment, but after multiple treatments that you're getting too much of muscles in your face, it will change how your face works. And over time, it will look weird. And not only is that bad to look weird over time, but it's bad because it happens so slowly. You probably will just be happy that your wrinkles are gone, but you won't realize it looks weird. So the trick is to find out what the right dose is, to figure out what dose will make you still able to be concerned, be surprised, be happy, but that when you stop moving your face, the wrinkles are gone. The second consideration is the stronger you go with Botox, the longer it lasts. So it does seem like it's much cheaper if you do a mega dose. However, it's a false economy because it looks unnatural. So if you do it too gentle, it's kind of gone in, a couple of weeks. So that's no good. I mean, not a couple of weeks, but like 8 weeks, 10 weeks, it can be gone that quickly. A good treatment, a natural treatment, has the potential to last from a minimum of 3 months up to 4 months. So you can have it natural and make it last 3 to 4 months. And I think everyone can really achieve 4 months. So that's kind of how it works. The next thing is, where can you get it done in the face? Which different areas can be treated? So there are a bunch of different areas. Initially, there was only one area that had a license, and then as time went on, more areas were added. So everyone knows the main 3 areas: in between the eyebrows, across the forehead, around the eyes. In the main 3 areas, the technique is, it's the most long-standing technique that people are doing for the longest, but it's sometimes the worst technique, because the recommended technique is not the technique that will make people look the best. It's the technique that if you get 1,000 doctors to do it, you're least likely to have any problems. So it's not the advanced technique. It's like a simple recipe for, something delicious. The simple recipe, yeah, you're going to get your beef Wellington or fillet steak or whatever it is, something delicious. But an advanced recipe, when you go through all these other steps and it's just slightly different, there's more likelihood that you'll make a mistake and botch it and ruin the meal. So doing the simple areas is not as simple as it sounds. So for example, across the forehead, usually what's recommended is 1 injection here, 1 here and here, 1 here and here, completely neglecting up here and completely neglecting across here. A lot of doctors are just afraid to inject in this area because in basic training, we're told never, ever, ever put Botox here because it can make your eyebrows move. Now, of course, we don't want anyone's eyebrows to droop, but when you don't do a small bit for some people in this section, again, it depends on the person, then those eyebrows can have a kind of funny little pull, a Mephisto, we call it, where the eyebrows are lifting up a little bit and it looks a bit evil, so that's no good either. So across this area, there's a special technique to do the standard areas. The standard areas are in between the eyebrows, across the forehead, around the eyes. Next most popular, I guess, is a brow lift. So again, the brow drops really slowly as we age. All these things are so subtle. So if you see someone and their brow's a bit heavy, then when you saw them 10 years later, the difference can often be as little as a millimeter. Like, the brow of an old person versus the brow of a young person is not 2 centimeters lower. It's literally a millimeter, maximum two, maybe 2.5 millimeter drop. And that takes 40 years. So we don't need to lift a lot to look good. So again, small amounts, and again, it's different for each person, are what's needed. The next area would be, I guess, around the eyes. So when people do the eyes, yes, they usually do 3 injections at the side of the eye, but the muscle around your eye, it's shaped like this, like a Zorro mask. It goes all the way from here, all the way around like that. So if you just do Botox at the side of the eyes, then you're weakening this part, but you're not weakening the part underneath or the part that's above. So that means you can end up with extra lines here and extra lines here. Maybe not in the first or second treatment, but over time it compounds. When your face is moving like this a lot more, then where the pulling forces are on your face, and it starts to change how you look. So that's why treatments can look more and more natural. Treatments that are done incorrectly can look more and more unnatural over time. So around the eyes, we can also do underneath the eyes, which nobody knows about actually. Whenever I say it to patients, they're always, surprised. They're like, "Are you sure you can do underneath the eyes?" But I do it for almost every single patient who does around the eyes. I do underneath the eyes. Now, again, it's a tiny, tiny amount. Like, it's very, very difficult to do such a small amount because I'm talking about a quarter of a unit sometimes even less, which is I won't show you a needle, but it's a really, really tiny, tiny, tiny amount. So it has to be quite precise. So underneath the eyes can help with horizontal lines that you get when you squint like this. The side of the nose is important because it's kind of part of this whole area. So the side of the nose, I've yet to see someone look unnatural with the side of the nose being done, but the side of the nose not being done when you've done the eyes can look very unnatural. We use this muscle here to kind of go, ugh, or snarl or be angry. So if you don't do Botox here and you've done it around here, your smile can still be using these muscles so you can look a bit snarly when you're smiling. So that's the opposite effect. It kind of makes people look, have a pinch of anger in their smile, which is weird. A snarly smile. Next area, you can do Botox to lift the nose. So if when you smile, your nose dips down, I'm not really a big fan of it. I've done it a few times, but not a lot of people have been looking for it. And I think if your nose goes down when you smile, you're kind of used to it. And I don't think anyone else really notices. But anyway, you can put a small bit of Botox here and it lifts that area up. The next one is, we said the brow, we said the bunny, we said underneath. Next is the gummy smile. So some people, when they smile, probably me actually, when they smile, they show more gum than they want to show. So they smile like that. And the perfect smile is where your lips sit just at the top of your teeth. So you can see your teeth, but your lips are just cutting off the tops of your teeth, if that makes sense. So if it's too high and someone's self-conscious when they smile, a little bit of Botox here and here weakens the muscle that we use to lift that, and that can correct the smile. So that's gummy smile treatment. Next is the lip, which has 2 different treatments that you can do. So smoker's lines, when people smoke a lot, they're doing this the whole time. So pursing a lot causes vertical lines that can then bleed into your makeup. So when you're doing lipstick, the lipstick can bleed upwards. You have like little lines coming up. So you can treat that with filler, but Botox can also be used to treat that. So by weakening the muscle that you use to purse. This same area can be treated quite similarly for something called a lip flip. So again, you can give volume to the lip and make the lip look fuller with filler, but with Botox, you can also improve the lip and get just a little bit more show, a little bit more height on the size of the top lip. So it kind of curls out slightly. Again, all this stuff is subtle. It's not like a crazy lip. Next, move down. So the DAO, this area is where if you make a sad face, which actually I can't do because I've had this area done myself. I do have a picture here, which I had to put on my iPad to show people. If you can make that face, I can't do it. But if you can make that face, and when you stop, the muscles are pulling down a little bit of Botox here into the DAO. DAO stands for depressor anguli, the muscle that depresses the angle of the mouth. So depressor anguli arms. So Botox into there will lift the corners of the mouth. So if you've got a sad mouth, it treats there. That's the next one. What else? Chin. If your chin, similarly when you're making a sad face, pulls upwards and you get dimpling of the chin, or you get a line across the chin, you can do treatment in this section. And that means that you don't get that line anymore. It also means that the puckering doesn't happen. The muscles in this area are quite complicated. They kind of interlock and integrate with each other in a funny way. So you want to make sure you get this area right. Otherwise, your chin can be doing all sorts of crazy things. So this is a very good area to treat. Again, you have to know what muscles are there, how to do it, how much to do it. Start with a small amount, and that's the chin. Next is the jaw. So masseter Botox is very useful for people who suffer with bruxism. So if you get severe pain in the morning, it's more of a medical treatment. If you get severe pain, sometimes causing headaches, Botox in here can settle that discomfort. Dentists recommend it. If you're grinding your teeth and wearing them down from like chewing all night, that's where that's useful. The other reason why people do it, it's very popular in Eastern Europe, in Asia, where people's faces tend to be a little bit wider in this section. So for a male face, men's faces, we want them to be kind of square and chiseled jawlines, whereas women don't want square chiseled jawlines. They want more of a V shape, which looks more feminine generally. So Botox into this section, if it's too wide, can narrow. Now, again, subtlety is key. There's a recommended dose from the guys who make the products, all the prescription medications. To be perfectly honest, their recommended dose is really high, and it kind of makes sense if they've got millions of doctors or tens of thousands of doctors using their products and they say use lots. It just makes perfect sense from a business perspective. If they tell them to use loads, they sell loads, but you really need to use a small amount. In this case, it's really important because too much here can mean that the width that kind of supports your face, when you lose that, you can get sagging and it can contribute to jowls. There's some pretty scary is a bit dramatic, but there are some pretty scary results when people have just been heavy-handedly hitting this area with a very high dose, and then a person who doesn't have jowls is prematurely getting jowls just to try and make their face a little bit slimmer. So again, everything that you do can affect other areas. So you need to start gently, take pictures, make a plan, and work from there. So that's all the areas. And that is that all the areas? No, it's not. Next, we have the neck. So the neck, I've also had this area treated, so it's going to be difficult for me to show you, but there's a muscle on your neck called the platysma, which goes from your collarbones up your neck, out to your jaw, and it actually connects with the DAO. So it connects up here. So it goes all the way across here, kind of meanders down your neck. It's on both sides. When we use that muscle, we make this face. So try in the mirror, it's quite difficult to make. I'm not really able to make because I've had it treated. You can see the muscle a little bit here in my case. Usually it's two heads of the muscle. So there's two parts that come out like this. So there's one here, one there. Anyway, when it comes up here, when that muscle tenses, it goes from being in against your neck to kind of tensing out that way. So when you relax it, it goes in this way. So by relaxing exactly on the edge and on the edge of the jawline, we get a nice kind of reshaping. So it becomes more angular, more sharp, or as my wife likes to say, it does. So it kind of does that. So I think that's it. There's another area that was popular for a while, Barbie Botox. So for shaping the shoulders, I'm not a big fan of it because those muscles are more functional than other muscles. The rest of the muscles that we've discussed so far, they are purely for communication. So this muscle, the main purpose of it is, it can keep the sun out of my eyes. That's a purpose. But the main purpose of most of the facial muscles is to communicate with other humans that I'm not impressed or I'm surprised. They should also be surprised. The muscle on your shoulder is really important for lifting things. So yes, while putting Botox in here can make your neck slimmer and appear longer, you might not be able to lift stuff. So that seems like a step too far. So unless someone is, really suffering, or unless it's very unnatural looking, I'm not a huge fan of that. So anyway, that's all the main areas of the face. So yeah, how it works is the person comes in, I take photos of you making lots of crazy faces. People look at their own photos afterwards and they usually crack up because they're like, that's hilarious. But my whole library is literally thousands and thousands of photos like that. In fact, so much so that my iPad will kind of do the memories feature where it'll give me a little notification, say, I remember that day on the 4th of June, 2012, and it'll show me 10 or 20 people, going like this. So that's all I take. They're terrible photos, but they're really useful for time stamping and for knowing how well treatment works. So it means if we're doing your treatment now with a small dose, I like to go much less than what the recommended dose is. So usually, for example, in this area, the recommended dose is 20 units. I will do a fraction of that to start with, because there's some people are really sensitive to it, Other people are very resistant and they need a big dose, but we don't know until we try what dose will work for you. So you start with a small dose, take the photos before, then when you come back in, we look at those photos and we see what it's done, and we can say, oh, that's kind of halfway there, or that's 80% there. And then we can wind up to get the right dose. So add more to get the right dose for you. Then we fine tune it the second time around, because if it hasn't lasted long enough, if it's only been 3 months rather than 4 months, like if it's gone exactly at 3 months based on our pictures, what you were like to start with, then we can say, okay, so it only lasted 75% as long as it should have. Let's add an extra 25%. So we'll do a little bit of maths around it and find a dose that works for each area so that it looks natural and the lines are gone as long as possible without looking weird. So that's kind of how it works. Most commonly when people get Botox done, they're most afraid of it looking unnatural. They're like, is it going to look weird? So it's not really a side effect, but that's the main side effect that can happen. So when someone is heavy-handed or in a rush to like figure out what the right dose is for you, doesn't take the photos, doesn't go through all that process, it can look weird. And that's the main side effect. And often 9 times out of 10, when it's not right for that first treatment, the patient is delighted that the line's gone, but actually something is not right. Maybe it's just not wide enough, or maybe the dose is slightly too strong, or maybe it's, something is not right with the way it's been done. It's really important at the start to tweak that, because people tend to come in for checkups on the first or second time, but then people will stick with the same dose for 5 years and they mightn't bother doing a checkup because it's a nuisance coming back in for an extra visit. But if the dose is kind of nudging you in a wrong direction and your muscles are moving against each other in a unnatural way, then 10 years of compounding that is going to be extra unnatural. So that's the main side effect. The first side effect is an unnatural treatment, and it may look natural at the start, but it can compound over time. The next side effect, again, is not really a side effect of Botox. It's an effect of needles. So if I took a needle and we used tiny needles, these are Korean needles, because for some reason they don't make them like this in Europe. The Koreans are obsessed with being beautiful, so they make the best needles. Someone should make needles here. It would be cheaper. Anyway, so we use these tiny needles, but if you were to take those needles, even though they're tiny, and jab yourself a bunch of times in the face without any Botox, you're going to get potentially some points that bleed. So it's a doctor's job to not go any deeper than necessary, not to do any more injections than necessary, avoid the blood vessels, and make sure that that doesn't happen. But that is a potential side effect, that if you do a treatment, you might get bruises. Most people do not get bruises, but I hate telling people that. I prefer that everyone expects to get a bruise. Like if I get 20 people doing a treatment on a day of Botox, I would say 1 would have a bruise that they might comment on that they had a bruise. Maybe 2 would have a small bruise that was like a spot, so they kind of forgot they had it, So maybe 1 in 20 would have a bruise, and usually it's the size of a spot. It's always something you can cover up with makeup. So bruises are rare, but they can happen. So anyway, with care, with small needles, if you're not on aspirin or blood thinners, it makes bruising less likely. Taking anti-inflammatories, don't be hungover. What else? Yeah, that's kind of how to avoid bruises. Pain is another effect. So there are 5 reasons why treatment might be different from time to time. So those would be, I think it's 5. If you're hungover, it'll be more painful. If you're tired, if you're stressed, if you're hormonal, so if it's your period or anything like that, or if you're sick. So any of those 5 things can make you find it more painful. Or if your doctor has any of those 5 things, that would also be an issue. But hopefully your doctor isn't hungover either. So that's the pain side of things. Next side effect. So we get into actual side effects. So what else? Allergic reaction. I don't know that it's possible with Botox, but Botox is a toxin. It's a poison. Botox is something that, if you consume enough of it, it will paralyze all your muscles. You won't be able to breathe and you'll die. But the amount that you'd need is hundreds of times what you would get injected in a single treatment. But I think because it's dangerous in huge amounts, that's why it's a prescription thing. That's why doctors need to do it and carefully mix it and all that kind of stuff. But in terms of having an allergic reaction to Botox, I don't believe that there is a documented case of someone having an allergic reaction to Botox. I'm open to be corrected, but I'm doing this for 20 years. I've never had someone having an allergic reaction to Botox. I do believe allergic reactions that have happened at the time of Botox can be due to 2 things. Number 1, if your skin is not cleaned properly and you're using needles that are, big enough and not sharp enough that they could actually push makeup or dirt from the surface of the skin into the skin. So not cleaning the skin can cause, inflammation. Pushing dirt into your skin can make your skin react. I know of a doctor who never bothered cleaning people's faces and was asking me, this is a long time ago, 15 years ago, do I get marks that last for days or weeks for people? I was like, no, what the hell are you doing? And after talking to him for a while, he wasn't bothering to clean people's skin. So It's really important to clean the skin. You can't get makeup underneath your skin, obviously. So, but allergic reaction where your body kind of freaks out, that's one reason why someone could have an allergic reaction, the doctor not cleaning the skin properly. Second reason is if you are mixing the Botox. So we mix it with just water with a little bit of salt in it. Not my recipe. We buy it like that. Some doctors in the past, I've heard of them mixing it with lidocaine, it's local anesthetic. I think this is like 10, 15 years ago. And one or two cases of people being allergic to that. But Botox itself, allergy is unheard of. What else will go wrong with Botox? So too much, not being done properly, bruising, allergic reaction, no. I think that's it. Yeah. So the most common outcome from when I do a first treatment for someone is that it's not enough because I aim to undertreat so I can see this area is at 70%, this area is at 60%, and then I can know what the right dose is. Once you paralyze a muscle completely, you might have done 20 units, you might have done 10 units, you don't know what the right number was. So it's better to get nearly there and then kind of top it up. It's no point in just putting loads in. That worked and then keep putting loads in for years. It's much better to kind of figure out what the right dose is by underdoing it. So that's a summary of anti-wrinkle injections. Come in for a consultation. When we talk about skin, there are three main things that keep people looking young and fresh. One is lines and wrinkles, and that's all anti-wrinkle injections. The other two are volume on the face. If you lose fat on the face as you get older, or if you lose a lot of weight, the face can sag a little bit. And restoring that fat, again, it's important to be done correctly and subtly. That can make the face look more rejuvenated. So lines and wrinkles is Botox, fat loss, volume loss on the face. That's generally filler. And then the third one is skin. So the skin can also be treated with injectables. There are a whole bunch of new injectables like polynucleotides, exosomes. It's not an injectable, but it's something that you push in with microneedling, and profiler. So skin boosters. There's a lot of skin boosters, Harmonica, that you can use to improve the quality of the skin with an injectable. But there are also a lot of treatments that you can do to improve the quality of the skin, not injectable. So in a consultation, we go through lines and wrinkles, we go through volume loss, and we go through skin quality, and we get that up to the best it can be. So looking forward to seeing you, book an appointment, and we'll go through what will work for you.